They say artificial intelligence might one day replace doctors. It's a headline designed to grab your attention, sparking images of cold, unfeeling machines making life or death decisions. But what if that's the wrong question entirely? What if the real story, the one unfolding quietly in labs and hospitals around the world, is not about replacement at all? Labs, quietly unfolding in labs, hospitals, and hospitals around the world. What if instead, AI could be the very thing that saves our doctors, and by extension, saves millions of us? This is not a story of machines taking over the art of medicine. It is a story of how these remarkable tools are helping us restore the human heart of it. One patient, one diagnosis, and one conversation. The narrative of AI in healthcare has been dominated by fear and science fiction, but the reality is far more practical and profoundly more hopeful. It's about augmenting human skill, not supplanting it. Before we can appreciate the solution, we must understand the scale of the problem. Hospitals, clinics, and doctors' offices are supposed to be places of healing, but for the people who work within them, they are often zones of immense pressure. Doctor burnout is a silent epidemic. In nations across the globe, clinicians are stretched to their limits, not just by the emotional weight of their work, but by a mountain of non-clinical tasks. Studies from the United States, for example, reveal a startling fact. Physicians can spend nearly half of their working hours on paperwork, data entry, navigating electronic health records. These are hours not spent with patients. This administrative overload has profound consequences. It fuels exhaustion, erodes job satisfaction, and contributes to a higher rate of medical errors. When a doctor is tired and overwhelmed by bureaucratic demands, their ability to focus, diagnose, and connect is compromised. This isn't a failure of the individual, it's a failure of the system. The World Health Organization has been sounding the alarm for years. The problem is projected to worsen, with some estimates suggesting a shortfall of 10 million health workers by 2030, primarily in low and lower middle income countries. The crisis is not abstract. It materializes in the real lives of ordinary people. Long waits, rushed 10-minute consultations, or no local doctor at all. In developed nations, the problem manifests as overburdened emergency rooms and delayed diagnoses. This is the environment into which AI is being introduced, not as a disruptive invader, but as a desperately needed form of relief. The promise of artificial intelligence in this context is simple and direct: to automate the automatable, to streamline the inefficient, and to give our healthcare professionals the support they need to do what they were trained to do: care for people. By tackling the root causes of burnout and inefficiency, AI offers a pathway to not only fix a broken system, but to make it stronger and more resilient than ever before. So, what exactly is this AI we speak of? Let's demystify the term. At its core, artificial intelligence is a field of computer science that enables machines to learn from data, identify patterns, and make decisions or predictions. Think of it not as a conscious robot, but as a powerful set of computational tools. It's like having an assistant who has read every medical textbook, every clinical trial, every patient case in history, and can recall any piece of that information in a fraction of a second. This assistant never gets tired, never gets distracted, never forgets. The amount of medical data in the world is doubling every few months. AI systems can sift through this data deluge, finding subtle correlations, revealing hidden patterns that might elude even the most experienced clinician. They can analyze a patient's symptoms, medical history, genetic information against a backdrop of millions of other cases, offering a data-informed perspective. This doesn't replace a doctor's expertise, it supercharges it. Diagnosis and disease detection, drug discovery and research, administration and patient care. It is crucial to understand that these AI tools are designed to be assistive. They present information, highlight risks, and suggest possibilities. The doctor remains the captain of the ship, with a far more advanced navigation system. Perhaps the most mature and impactful application of AI in healthcare today is in diagnostics. Every year, millions of medical images are created. X-rays, CT scans, mammograms, retinal scans. Analyzing these images requires a highly trained eye, but even the best radiologists can get fatigued and miss subtle signs. AI excels at visual pattern recognition. Trained on millions of anonymous scans, these algorithms identify anomalies with high precision. They often spot signs too small or ambiguous for the human eye. Take, for instance, tools from major research labs, like Google's MedPaLM 2. Presented with a complex case, It can generate a differential diagnosis and explain the reasoning behind each suggestion. Another tool, Glass Health, acts as a clinical co-pilot. A physician inputs symptoms and findings, and the platform drafts a comprehensive workup with citations, saving hours and reducing oversights. Studies in journals like Nature Medicine show AI detecting some cancers with accuracy matching or exceeding human experts. For a patient, that could mean catching a tumor at stage 1 instead of stage 3. It's not about machines being smarter than doctors. It's about machines screening thousands of images without tiring, flagging the few that need a doctor's focus. This partnership makes diagnosis more robust and reliable, a powerful safety net. Imagine a busy emergency room late at night. An AI flags a faint shadow on a chest X-ray, or a subtle bleed on a head CT. Look here, this might be important. The process of bringing a new drug to market has been incredibly slow, expensive, and fraught with failure. AI is poised to radically overhaul this broken pipeline. Using immense processing power across biological and chemical data, AI can identify promising candidates, predict effectiveness, and design new molecules in a fraction of the time. Companies like In Silico Medicine used AI to identify a novel target for idiopathic pulmonary fibrosis and design a new molecule. The whole process took roughly 18 months, a task that would normally take many years. Platforms like BioGPT and Benevolent AI read millions of papers and trial results to find connections no human team could. This approach dramatically accelerates timelines by pruning dead ends and lowers costs by improving R&D efficiency, making medicines more accessible worldwide. The cure might be hidden in a vast sea of literature. A human might spend a lifetime searching. An AI can scan it in days and point to the most promising links. AI isn't replacing the scientist, it's giving them a map to the treasure, allowing them to dig in the right place from the very beginning. Another, less glamorous application is transforming the daily life of doctors, tackling administration, the ultimate scribe and assistant. For every hour with patients, doctors spend up to 2 on documentation. Pajama time that drives burnout. New AI tools give that time back. Tools like Nuance DAX and Hippocratic AI listen securely, transcribe the consultation, and structure a perfect note, ready for review and sign. The doctor is freed from the keyboard, more eye contact, active listening, a natural conversation. The focus returns to the human being. Beyond documentation, AI improves access. Chatbots like Babylon Health and Ada Health ask intelligent questions, provide reliable health information, and triage to the right level of care. In underserved areas, this can be a lifeline, managing demand and getting patients to the right place faster. For the system, it reduces administrative load, optimizes patient flow, and reserves precious clinician time for complex judgment and empathy that only humans provide. With all this talk of data, algorithms, and efficiency, it is easy to lose sight of the true purpose of healthcare: to care. The most profound promise of AI is not just speed or accuracy, but freeing humans to be more human. Medicine is both a science and an art. The science is in the data, the diagnosis, the treatment plan. The art is in the communication, the empathy, the trust. For too long, the demands of the science overshadowed the art. AI takes on repetitive, data-intensive tasks and gives time back to clinicians. Extra minute to ask about family, space to listen fully without the blinking cursor, emotional bandwidth for a word of comfort or a reassuring touch. These moments define compassionate care. They build trust, reduce anxiety, and contribute to better healing outcomes. Imagine a clinic where technology serves humanity. A doctor walks in, not with a laptop, but with their full, undivided attention. The AI documents. The doctor is fully present. They notice a subtle hesitation, the flicker of fear, the slump of shoulders. No algorithm can interpret these in context the way a human can. This is the human side of the technological revolution. Not a cold, automated system, but automation that protects space for warmth and empathy. A machine can analyze a blood test. It cannot comfort a parent. A machine can schedule a follow-up. It cannot share in the joy of remission. AI handles the paperwork so the doctor can handle the person. The shift is not a single dramatic event, but thousands of small, meaningful victories. Consider a rural clinic. Hundreds get reliable advice instantly. A mother manages home care. Another user is urged to seek emergency help for heart attack symptoms. In a cancer center, an AI surfaces a little-known targeted therapy. A month later, the patient is in a trial with a remarkable response. A surgeon rehearses on a precise 3D brain model, avoiding critical pathways. The robot didn't perform the surgery, it gave a better map. It's the radiologist spotting a tiny nodule thanks to a prompt. The primary care doctor ending on time, less burned out. Small wins day by day, quietly fixing the cracks. Together, they build a foundation for a more effective and compassionate future. As we embrace AI in medicine, we must proceed with our eyes wide open. This technology is powerful, and with great power comes great responsibility. The most pressing concern is bias. If data reflects historical imbalances, say trained mostly on male patients, recommendations may be inaccurate or unfair. Privacy is fundamental. Medical data must be protected, anonymized where appropriate, and used only to improve health. Accountability matters. If AI contributes to error, who is responsible? We need clear legal and ethical frameworks. The WHO urges ethical, equitable, and safe AI. Doctors cannot trust a black box. We need explainable systems, rigorous independent testing, and continuous monitoring, like any new drug or device. Design fairness, transparency, and human oversight from the beginning. Build tools that reduce disparities, not amplify them. As we stand on the cusp of a new era, imagine a future not of robotic doctors, but of augmented healers. AI continuously monitors vitals, labs, and wearables, creating a digital twin. It predicts sepsis or cardiac arrest hours before symptoms, enabling life-saving intervention. Treatment plans tailored to genetics, lifestyle, environment. AI predicts which drug and dose will work best, with the fewest side effects. Medicine becomes exquisitely precise. Drug development turns hyper-personalized, treatments for an audience of one. Freed from routine tasks, clinicians focus on complex problem-solving, communication, and ethics. Conductors of an orchestra of information. Training evolves, data literacy, and seamless collaboration with AI assistants. Most valued skills: critical thinking, creativity, empathy. Access is democratized. A patient in a remote village and one in a major hospital share the same diagnostic insight. Technology dissolves into the background, working silently to support care. This is not a distant dream. It is the logical extension of the path we are already on. We began with a question: what if AI could save our doctors? By now, the answer should be clear. AI is not the hero of this story. The heroes remain the doctors, nurses, scientists. AI is simply the new tool in their bag, the most powerful in a generation. It can help them see more clearly, think more broadly, act more decisively. It can lift the crushing burden of administrative work and give them back the time to do what they do best: care. The future is not a choice between machines and humans. It is a synthesis. The goal is not artificial intelligence, but amplified intelligence. MedPaLM 2, Glass Health, In Silico Medicine, Nuance DAX. They are signposts pointing toward a future where technology and humanity converge to improve outcomes for all. But this hopeful future is not guaranteed. It depends on the choices we make today, championing fairness, transparency, and robust oversight. We must protect patient privacy and use these tools to close equity gaps. We need training and education to prepare clinicians for this new environment. This requires a conscious, collective effort from patients, citizens, and stewards of our shared future. Let us move forward with careful optimism, solving medicine's toughest challenges. The stethoscope did not replace the doctor's ear. It allowed them to hear the heart more clearly. AI will not replace the doctor's mind. It will help them understand the symphony of human health with greater depth and clarity. Guided by wisdom and compassion, AI becomes a force for healing, helping more lives. This is the future of healthcare, not artificial, but amplified. AI isn't replacing doctors. It's helping them heal the world faster. Watch more highlights. Subscribe for AI truths.